If the diagnosis is made of breast cancer, then what do you do? How do you know if it's spread? What's a sentinel node?
Well, first of all, a sentinel node is something that a surgeon would look at the time where the breast cancer is removed. And basically, they can inject material around that tumor and trace it to a lymph node underneath that arm on the side of that breast cancer. And the sentinel node is that first lymph node that drains that cancer. And so if there's cancer in that node, they might have to take more nodes out. However, if that lymph node is negative, they don't have to take any more lymph nodes out where they would normally do that in the past.
So that's why it's so important. Now, why does breast cancer, how easy does it go to that lymph node? How do you know where the sentinel lymph node is? What happens around cancers that make that sentinel node so obvious?
Well, it's probably not that obvious, but I guess the issue is that you can trace that from the tumor either by injecting radioactive material and following that radioactive material to that lymph node, or actually inject some dye and trace it to that first lymph node. Because you can't be sure which is that sentinel lymph node, but now they have these studies where you can do that.
So positive sentinel node means that it started to spread and you're going to have to be more aggressive. Let's say it was negative. What are the options then if somebody has breast cancer hadn't spread, as far as you know?
As far as surgery is concerned? Well, actually, you're making those options even before you do the sentinel lymph node. So the options for surgery could be a partial mastectomy, and that's typically for tumors that are isolated tumors in the breast, typically smaller, and then the surgeon can get around those. So usually they'll do a partial mastectomy, get around that, get clear tissue around those margins, and at the same time they'll do the sentinel lymph node then.
Is that scary for the surgeon as far as being sure that he gets everything out but not doing a total mastectomy? Is that the same thing as a lumpectomy?
It'd be a lumpectomy, partial mastectomy. These are all kind of similar terms.
Is it hard to make a decision whether to do the total mastectomy for the surgeon?
Well, from the surgeon's standpoint, if a tumor is really too big, that might be an issue, or if there is multiple tumors within the breast. And so one way, before they even go to surgery, they might even have a breast MRI to make sure there's no other focal areas in that breast for a surgeon to determine what might be the best surgery for that patient.
Are there some options other than surgery?
Not for cancer, no, not in this day and age yet.
So chemotherapy and radiation is in addition to surgery at our current day, is that correct?
Radiation you would certainly need if you had a partial mastectomy to complete radiation to the rest of the breast. Some people still need radiation even after mastectomy if their tumor is big enough or if they have multiple lymph nodes involved.
It's very, very, very important that the doctor, the oncologist, understand the extent of the breast cancer so they know exactly what kind. Chemotherapy good?
Chemotherapy has improved considerably, and that's an issue that we are looking more targeted therapy right now for some of these patients.
And the targeted therapy can really improve survival rates for these patients?
Well, the biggest example is HER2 positive breast cancer. That's a receptor on cells. About 20% of women have that HER2 positive breast cancer. And that receptor tells those cancer cells to divide quickly and spread quickly. There's a drug now, Herceptin, which has improved over 50% survivability in these women. Well, that used to be the worst cancer we used to see, HER2 positive. We never wanted to see that. Now we want to see it because it has made such a big difference in the last 5 years.